Depression is the leading cause of disability worldwide, but what exactly separates it from just feeling sad? Depression stands as the #1 cause of disability across the globe. In America alone, nearly 1 in 10 adults lives with this condition. Yet, because depression is a mental health disorder, grasping what it truly means can be much more challenging than understanding something physical. A major point of confusion for many people is distinguishing between clinical depression and simply feeling sad or low. The truth is, almost everybody experiences periods of feeling down. A disappointing test score, being let go from work, a heated disagreement with someone close, or even just gloomy weather can trigger feelings of unhappiness. Sometimes these feelings arise without any obvious reason whatsoever. They just appear seemingly from nowhere. But then life moves forward, situations shift, and those feelings of sadness fade away naturally. Clinical depression operates on an entirely different level. This is a legitimate medical condition that doesn't simply vanish because you wish it would. It persists for a minimum of 2 weeks without interruption. And it seriously disrupts your capacity to function in major areas of life, whether that's performing at work, enjoying recreational activities, or maintaining meaningful relationships. The symptoms of depression can vary widely from person to person. You might experience a persistent low mood that won't lift. Activities and hobbies that once brought you joy may suddenly feel meaningless or uninteresting. Your eating patterns might change dramatically, either losing your appetite completely or eating far more than usual. Feelings of worthlessness can take hold, or you might feel overwhelmingly guilty about things that aren't your fault. Sleep becomes problematic in either direction. Some people sleep excessively, while others lie awake for hours. Concentration becomes difficult, making even simple decisions feel impossible. You might feel physically agitated and restless, or conversely, everything you do might feel like it's happening in slow motion. Energy drains away, leaving you exhausted even after rest. In severe cases, thoughts of suicide can occur repeatedly. According to established psychiatric diagnostic criteria, experiencing at least 5 of these symptoms qualifies as clinical depression. But this condition isn't just about changes in behavior or mood. Depression creates real, measurable changes inside the brain itself. Some of these changes are visible through medical imaging technology. Researchers have observed that certain brain regions, particularly the frontal lobes and areas of the hippocampus, actually become smaller in people with depression. Looking even deeper at the microscopic level, depression is linked to several specific brain changes. The communication between brain cells can become abnormal, or certain crucial chemical messengers called neurotransmitters may become depleted. 3 neurotransmitters are especially important here: serotonin, norepinephrine, and dopamine. Additionally, the body's natural daily rhythms get disrupted, and specific phases of sleep, particularly REM sleep and slow-wave sleep, show distinct abnormalities. Hormonal imbalances also play a role, including elevated levels of cortisol, the stress hormone, and irregular functioning of thyroid hormones. Despite all this knowledge, scientists still lack a complete understanding of what triggers depression in the first place. The current thinking points towards a complicated interaction between genetic predisposition and environmental factors. But there's no test available that can reliably predict who will develop depression or when it might appear. The invisible nature of depression symptoms creates another challenge. It's incredibly difficult to identify who might be silently suffering while appearing perfectly fine on the outside. The National Institute of Mental Health reports a sobering statistic. On average, people living with mental illness wait more than a decade before reaching out for professional help. The encouraging news is that highly effective treatments exist. Antidepressant medications work alongside various forms of therapy to restore proper balance to brain chemistry. For the most severe cases, electroconvulsive therapy can be remarkably helpful. This involves inducing a carefully controlled seizure in the brain. Researchers are also exploring other innovative approaches, including transcranial magnetic stimulation, which shows significant promise. If someone in your life is battling depression, gently encourage them to explore these treatment options. You could offer practical assistance with tasks that might feel overwhelming to them, such as researching local therapists or preparing questions to discuss with a doctor. For someone in the grip of depression, even these initial steps can feel impossibly difficult. Should they express feelings of guilt or shame about their condition, remind them that depression is a medical illness, no different fundamentally from asthma or diabetes. It's not a character flaw or personal weakness, and they shouldn't pressure themselves to simply snap out of it any more than they could will away a fractured bone. If you've never personally experienced depression, resist the urge to compare their struggle to times when you felt temporarily sad. Drawing parallels between clinical depression and normal fleeting sadness can inadvertently make them feel guilty for not coping better. Simply creating space for open dialogue about depression can make a meaningful difference. Research has even demonstrated that asking someone directly about suicidal thoughts actually lowers their risk of suicide. Honest, open conversations about mental health help break down stigma and make it easier for people to seek the help they need. As more individuals pursue treatment, scientists gain more insight into depression, leading to increasingly effective interventions.